Hi, I'm Syarifah Nazihah binti Masri from Universiti Kebangsaan Malaysia Medical Center. The title of my presentation is Effect of a Goal-Directed Fluid Therapy in Renal Transplant on Post-Operative Outcome, a retrospective study. A renal transplant is a gold standard treatment for individuals with end-stage renal failure. The success of renal transplant surgery is measured by early graft function and its long-term viability. The optimal fluid therapy reduces the incidence of delayed graft function following a renal transplant surgery, maintaining a good cardiac output and tissue perfusion by ensuring adequate intravascular volume is the most important measure intraoperatively. We retrospectively compared the effect of intraoperative conventional fluid therapy using a central venous pressure versus the goal-directed fluid therapy using a stroke volume variation via a pulse contour analysis using FlowTrack EV1000 on the incidence of delayed graft function and other post-operative outcomes such as metabolic acidosis, cardiorespiratory complications, and in a renal transplant surgery. 179 patients who underwent renal transplant surgery in single tertiary hospital center between January 2014 and December 2019 were retrospectively analysed. Patients were excluded if there are pre-existing malignancy, blood loss more than 1.5 liter, and cold ischemic time 15 hours or more. Patients were divided into two groups based on the fluid therapy that they received during surgery. Those who are in conventional fluid therapy receive the fluid based on guidance by a central venous pressure of 8 to 12 meter mercury and MAP of 80 millimeter mercury, while patients in a goal-directed therapy, they were managed by targeting SVV of 10% within the preoperative baseline and MAP of 80 millimeter mercury as guided by FlowTrack and EV1000 sensor. The preoperative characteristic and intraoperative parameters were evaluated to determine their association with post-operative outcome. Table 1 shows demographic and intraoperative data. It shows that the age, gender, ASA status, hypotension episode, and cold ischemic times between the two groups were comparable. However, in a goal-directed therapy group, patient received less fluid intraoperatively and higher vasopressor requirement compared to a conventional fluid therapy. Table 2 shows a post-operative outcomes. It shows that in a patient who had a delayed graft function, 71% were from the conventional fluid therapy group, and this data was statistically significant. And there are also reduction in post-operative metabolic acidosis, cardiorespiratory complications, ventilator dependency days, and post-operative ICU stay and hospital stay, which is lower in a goal-directed therapy group compared to a conventional fluid therapy group. In conclusion, intraoperative goal-directed fluid therapy reduced the incidence of delayed graft function and improved a post-operative outcome.